Heart disease, it is the #1 killer for all Americans. But for African Americans, the risk of getting the disease is even higher. The good news, you can improve your odds in preventing it and beating it. When we come back, we've got information on the risk and tips that could help save your life. Every year, Americans suffer more than 1.5 million heart attacks and strokes. 44% of those are African American men and 48% are African American women. Heart disease is the #1 killer in the African American culture. So here to discuss the risk factors and also tips to help us keep that blood pressure under control and the potential risk of heart disease is Dr. Ketlogetswe. She's a cardiologist with MedStar Health. Thank you so much for coming in, Doctor.
Thank you so much for having me on.
So this is Heart Month as well as Black History Month, so let's...
What a great opportunity to talk about two things: heart disease and African Americans and the risk for heart disease.
Why do we see such a large risk with the African American community?
I think mostly it's because a lot of the risk factors tend to be more prevalent amongst African Americans. So for example, high blood pressure or hypertension tends to be very prevalent in African Americans. And when they do develop it, it tends to be more severe and to occur earlier in life, exposing you to a longer and higher risk for having heart disease.
Now, how many of these things are they tied to diet or weight or what other?
So for example, high blood pressure is probably multifactorial, right? It's a combination of genetics. There are theories that African Americans tend to be more salt sensitive, and so exposure to high sodium diets like we have in our fast-paced lifestyle means you can get high blood pressure more likely. Sometimes it's related to things like obesity. African Americans carry a high prevalence of overweight and obesity. So if you look amongst African Americans, 63% of men and 77% of women are considered overweight and obese. Those are huge numbers, and it's a really modifiable risk factor.
So have things gotten better or worse, Doctor? You know, with all the advance of technology and everything, stories like this, that's getting the word out.
I think things have gotten better, but the key thing is to actually know your risk. For example, high blood pressure is considered the silent killer because you don't know you have high blood pressure, and many people are asymptomatic. If you don't know you have the disease, you can actually treat it. So know your numbers. Know what your blood pressure is. Know what your cholesterol levels are. Know whether you have diabetes or not, and talk to your doctor about getting on medications to help treat that. If you smoke, quit. Right? And most importantly, start a heart-healthy lifestyle that includes exercise most days of the week. The American Heart Association recommends that you try and get 30 minutes of brisk aerobic exercise most days. So do what you love: walking, running, biking, swimming, yoga, but try and get active and get your heart moving.
It's important all year long, but why, you know, a month like Heart Month, to get that message out, why is this so critical?
As you said, it's the #1 killer of all Americans, but African Americans are disproportionately affected by heart disease. So we like to use this month to try and really encourage people to become more aware of their heart health and learn their numbers and get in touch with their doctors.
And women, we typically take care of everybody else in the family.
That's so true.
And not take care of ourselves.
Exactly.
So you really need to be in tune with your numbers.
Absolutely.
Okay, all right. Dr. K, I'm going to call you Dr. K since I got it right the first time. Thanks so much for coming in.
Pleasure to be here. Thanks for having me.
Information, and we're going to have much more on our website, so you can always look it up there. Thanks a lot.